our client, our patient Zorro in the chair. We will be targeting 3,500 to 3,700 grafts for Zorro. He is more on the limited side of the donor region, and we are targeting the first half of the scalp, zone 1, zone 2, about 3,500 to 3,700 grafts, see what his donor region can supply. And then a year later, depending on how much donor strength he has, we're going to do the second half, zone 3 and zone 4. Okay, so it'll be part 1 and the part 2. Alright, so what we're going to do now, Zorro, is we're going to start the donor region prep, clipping and the numbing of the donor region, okay?
Okay.
Alright, ready, Zorro?
Yes.
So what we're doing now is we're creating the grid for Zorro's donor area so that we don't over harvest one specific area and we're able to evenly distribute the grafts so that one area doesn't look more thin than the others, okay? Okay, Zorro, so what we're gonna do now is we're gonna disinfect the donor area and we're gonna inject some of the numbing, okay? So you're gonna feel something cold. Don't worry, it's not ice. It's the disinfectant, okay? I hope it's not too cold, Zorro.
Oh, it feels good.
It's a nice hot day out today.
Yeah.
So you're gonna feel a small vibration device on the back of your neck. That's just to distract the nerve, so hopefully the injections won't hurt too much, okay?
Oh.
Good. So you're gonna feel some pokes coming this way, and then up top coming this way, okay?
Okay.
You ready?
Yes.
Very good. 1, 2, 3.
You're doing awesome, Zorro. Almost. Good job.
The bottom part's all done. Thank you.
How bad was that, Zorro? Bearable? That's the worst part, okay? You're doing fantastic.
Now we're gonna do the top part, okay, Zorro?
Okay.
1, 2. All done.
Good job, right side's all done.
Thank you. Let's have some juice for Zorro.
What'd you order for lunch?
Thank you. Lunch. I get steak.
You got order steak?
Good choice.
Really good steak across.
Zorro, now we're gonna do the left side, okay? It's a bit smaller, so it shouldn't take as long. Okay?
Mm-hmm.
Ready?
Yep.
1, 2. 3, 2, and 1. Very good. And now the top part, okay, Zoro? Almost done. Last part. 3, 2, and 1. All done, Zoro.
Good job, Zoro.
Perfect.
Awesome.
Now the team, what they're gonna do, Zoro, is they're gonna ask you to stand up, and we're gonna get you in position, okay?
Okay.
We're gonna do the harvesting. As you know, the procedure has 4 phases.
Mhm.
Harvesting, design, incisions. After lunch, we're gonna conclude the day with implantation. All right? Awesome, you did fantastic, Zoro.
How are you feeling, Zoro?
Good.
Very good. Any pain?
No.
Not too bad, right?
Perfect.
Very good, my friend. We'll be done soon. Your grafts are coming out great. Your numbers are looking really good as well, okay? Very good. Zoro, your grafts are coming out great.
That's good.
You're feeling okay?
Yep.
Very good. Nice number of triples you have here. Doubles and triples. Very good. Coming up nice and smooth, okay? Thank you. All right, Zoro, we're done with the harvesting phase. You did great.
Perfect.
Anything happen? Anything bother you?
It was great.
Any pain?
No.
No.
Most likely I slept.
We heard you snoring, Zoro.
Yeah, it happens all the time. Very good.
Alright,
Jacques, what are the numbers?
Alright, so we were targeting 35 to 3,700. Of course, you could have used more than 3,700. You're close to 4,000 grafts right now, Zoro, at 3,983. And your percentages are 667 singles, 2,028 doubles, and almost 1,300 triples. So you have over 83% doubles
Wow.
and triples, which is actually good.
numbers. Yeah.
Knowing that your donor was limited to begin with, these are actually not bad numbers.
That's
Okay,
alright.
so you got 17 shy of 4,000 grafts. If we can cover a little bit into zone 3, we will.
Very
Okay.
good.
Okay?
Great.
Awesome.
Thank you. Yeah.
So what we're gonna do now is we're going to disinfect the scalp, and we're gonna do the design phase. Okay, Zoro?
All right.
Zoro, now just look forward. And we're gonna disinfect, okay? Thank you. Very good. We're disinfecting. It's a little cold. Okay. Very good. Try to avoid touching your forehead and your head at this point, okay?
Mhm.
We're disinfecting. Alright, Zoro, we're gonna break down your face into 1/3 to see where everything should go, okay?
Okay.
Very good. That's about 15 centimeters. So perfect hairline will be at around 7.5, okay? Right there. We're gonna start the design phase now, my friend.
Nice.
All right. All right, let's get a mirror. Zoro, what do you think?
Looks good.
You like it? You approve?
Perfect, yeah.
So Zora, when it comes to a hairline, what you don't want is something that's too perfect, not too straight. Right and the left should look similar, but not 100% identical.
Yeah.
Okay. So with Dr. George's, he also placed these little irregular softeners in the very front of the hairline.
Mhm.
You see these random dots?
Mhm.
These are all going to be single hairs in the very front
Oh.
to give you that soft,
Okay.
natural appearance. Okay.
Looks good.
All right.
I like it.
Good.
Good. You approve?
Yeah.
Awesome.
Very good, Zoro. So what we're gonna do now is we're just gonna shave your head, and we're gonna finish up the design process, and then we're gonna start incisions. Okay.
Alright.
All right, my friend.
Very good.
Any discomfort while I do this, Zoro?
No?
Pain?
No?
All right, Zoro. Have you seen yourself with your head shaved before?
No.
No. Let's hope you don't like it too much. Take a look. Chin down a little bit. Very good.
You
So
see it?
this is your zone 1,
Mhm.
your zone 2, and your zone 3. This zone 1 is going to have a little more density than zone 2, but what we don't want to do is have it stop abruptly where this line is, where your zone 2 ends. So we're actually going to blend it in a little bit more into your zone 3 so that it has a little bit more of a natural look. Okay?
Perfect.
Blends in nicely into your zone 3, although the focus is going to be zone 1, zone 2.
Mhm.
Zone 1, double the density compared to 2, because this is what's going to frame your face.
Okay.
And then we're going to go slowly towards as much as we can with that almost 4,000 grafts for you, okay? All right.
Very good.
So you
Thank
are
you.
technically halfway done, Zoro, with the day. As you know, the procedure has 4 phases: harvesting, design. We're already done with the harvesting, we're done with the design. We're gonna work on the 3rd phase right now. You see how fast the time went by? What we're gonna do now is we're gonna do incisions. We're gonna
Okay.
follow a natural angle direction. Clients who do have it, we follow their pattern. Clients who don't, we have to recreate it.
Alright.
Okay, so what we're gonna do now is we're gonna put a pillow in the back.
Mhm.
Need you to rest as far back as you can, and we're gonna numb the top of the scalp.
Okay.
You're gonna feel 2 injections here, 2 injections here. Okay? Alright, Thelma, if we can please have the pillows.
All right, Zoro, what we're going to do now is we're going to do a nerve block so we can numb 75-80% of the forehead and the scalp
Mhm.
so that you don't feel all the incisions that we're going to make in the post, okay? So what I'm going to do is I'm going to disinfect the eyebrows.
You're gonna feel a quick injection here, here, supratrochlear and orbital nerves we're gonna numb, okay? It's gonna go by super duper fast, Zori. It's the most sensitive part, but it's gonna go by super fast. Let me have a dry gauze, please. You're gonna feel a vibration device on the forehead. And like Dr. George said, don't make any sudden movements, okay?
Okay.
We don't want the injection going anywhere else, it doesn't belong.
Very good. Okay. 2 quick pokes, okay, Zoro? Ready?
Mhm.
1, 2, 3. 1, 2, 3.
Beautiful.
Not so bad, right?
Sensitive. Let's have some juice for Zora, please. Alright, Zora. Lift up your head. Here's a little juice. You're gonna sneeze? Alright, Zora. what we did on the right, we have to do the same on the left, okay? Most sensitive, it's gonna go by super fast. These are tear jerkers. You might notice tears coming out. On the count of 3, here we go. 1, 2, 3. That's it. And here comes the second one. Relax the eyebrows. Don't move. 1, 2, 3. That's it. You did it. Good job. So we're gonna go back on the right eyebrow. It should be completely numb. You should not feel a thing, okay? All right.
Ready?
There we go. Close your eyes.
1, 2, 3.
No pain, right?
1, 2, 3.
Any pain?
Any pain with those
No.
two? Very good.
Beautiful. Same on the right side. Don't move. 1, 2, 3. 1, 2, 3. You did it. Good job, Zoro. All done. Fantastic. You did amazing, Zoro. And apologies, this is the worst part for this phase. But you saw it was not even 2 seconds on the right, not even 2 seconds on the left. The reason why we did this is it's gonna numb 75–80% of the scalp on top, okay? Alright, we're gonna start the incisions. George is gonna start the incisions. About an hour and a half or so, then we're gonna break for lunch. After this, last phase that we can see. Alright, you did awesome, my friend, okay?
Thank you.
You got it.
How you doing, Zoro? You doing okay?
Yes, doctor. I'm good.
Very good. Any complaints? Anything bugging you?
No,
Very good.
all is good.
Very good. So we just finished up zone 1. We're gonna work a bit on zone 2 now, okay?
Okay.
Zone 1's looking great. We're gonna work on the right side. Zone 2. Ready, my friend?
Yes.
Very good. Any discomfort? Anything bothering you?
No.
Very good. Alright, Zoro, so what we're gonna do soon is we're gonna take some blood from the IV line that you already have so we can do some PRP for you, okay?
All right.
And that allows for some sooner growth as well as recovery and some higher survival rate of the grafts as well.
Perfect.
Okay?
Yeah.
Very good. We'll get them in here shortly to be able to do that for you, okay?
All right.
Awesome. You're feeling great, right?
Yes.
Very good, my friend. If you need anything, you make sure you let us know.
Alright, Zoro. How's lunch?
It's so delicious.
Have you had a bite
Thank
yet?
you. Thank you so much.
You're welcome.
Beautiful,
Alright, I'll
thanks.
let you go. We'll get started pretty soon, okay? Once you're done.
All right.
Enjoy.
Sounds great. Thank you.
Alright, Zoro, it's time for your PRP, my friend, okay?
Okay.
How you holding up so far?
Yes.
Very good. So right now what I'm doing is I'm injecting the PRP,
Okay.
and like we discussed earlier, this will help with some sooner growth as well as shorter healing times, okay?
Okay.
Any pain or discomfort as I do this?
Nope.
Very good. All right, my friend.
I'm psychic. You did it. Oh my gosh.
You're good.
I am.
My goodness. $20.
Yeah.
I'll take it. My parents used to tell me, don't believe everything you see. Who brought you those? Of course, they also told me the Easter Bunny was real. and Santa too, because there were presents under the tree. And I knew the tooth fairy was real, because in the morning that tooth, it turned to money. If the tiniest bit of evidence will make us believe the unbelievable, what would I have to show someone to make them believe the impossible?
Congratulations, Zorro. You're all done.
Thank you.
How you feeling, my friend?
Good, very good.
Very good. Excited that it's all over, huh? You've been waiting a long time to do this.
Yeah.
Have you seen it, Zorro, yet?
No, not yet.
Not yet. Okay.
All right. Almost done up here. I'm excited to show you. We did your hairline. It looks great. Zone 1, Zone 2. And you'll see how quickly your donor area is going to heal by tomorrow.
Yeah.
And over the next few days. Now, Zorro, you still have a lot of puffiness in your head, a lot of tumescence extra fluid that we put in there so we can do the procedure. And over the next few days, you'll notice that that swelling is going to work its way down your face. And all these grafts that we put in, they're going to get compact even tighter, okay?
All right.
Over the next couple of days. So let's get a mirror for Zorro so he can see what he looks like now.
Sure.
All right, Zorro. Let's take a look here. You get to see it now.
Keep in mind what you see, Zorro, is swollen, okay?
Wow.
You see how this is going to come down to here.
Oh, yeah?
All this
This-
extra fluid,
All of this is fluid, okay?
it's going to work its way down
It's
over
gonna-
the next couple of days.
Wow.
Now you have a
Looks
hairline. You
good.
had nothing this morning.
Wow.
And the density is amazing,
This looks good.
okay?
All right, Zorro. Now let me ask you,
This is,
what do you
looks
think? Do you
good.
like it or do you love it?
Yeah, I love it.
Did you steal my line?
I
I
did.
love it.
He's, my brother stole my line.
Family rights, what can I say?
Wow. Thank you so much, guys. You did great job. Thank you
I
very
love
much.
it. Looks very good, Zorro. The hairline's
Thank
nice
you
and
very
irregular. Right and the left look pretty similar, but it's not identical. That's something that's very important. Anything that's too perfect, it'll scream man-made. So let's have the mirror one more time.
Sure.
Hold it.
Here goes, Zorro.
Zorro, take a look at this. You see how when I press on the skin, it
Mm.
dimples? That's all fluid.
Okay.
That's gonna come down the face.
Oh, yeah.
The next 3 to 5 days, which is going to cause your face to swell up, and this hairline is going to come down, okay? We didn't want to give you too low of a hairline like this, because then you wouldn't have enough donor to cover zone 3 and zone 4. So we kind of gave you a hairline, a good balance, without being too high, without being too low, so you get more coverage in zone 3 and zone 4. Once
Oh,
the donor
this is really
region
good.
heals, then we can also complete the task by doing zone 3 and zone 4, okay? But this is gonna look amazing, super high density. You had over 82% doubles
Yeah.
and triples, if I'm not mistaken.
This is perfect.
And you have to keep in mind, results will take a year and a half, okay? Full results.
Full,
But
yeah.
by 6 months, you're halfway almost, 40 to 50%.
Okay.
It looks fantastic.
Yeah.
Okay?
I can
Next
tell.
few days, this is gonna drop. You're gonna have puffiness, but no pain. But
Thank
I
you
love it.
so much, guys. I really appreciate it.
You
Thank
like
you
it?
very much. I love it.
Good.
Mm.
Oh, you
Thank
said
you.
it.
Thank you so much.